Hello there again. I don't know if you knew I had a brief intermission, but I did, so I'll pick up where I left off. Some insurance companies do require a certain number of nutrition appointments, so you just want to make sure that you have called them to confirm what that requirement is. We have a pretty good idea, but that they even cover bariatric surgery. And that'll be real important. You do not want to be paying for this surgery. It's quite expensive. Okay, so that's one tip to avoid delaying your surgery is to make sure you've contacted your insurance company. Insurances like Aetna require 4 nutrition visits. Most of the Horizons require at least 3 nutrition visits. So the surgeries we do are the sleeve and the gastrectomy and the gastric bypass. We don't do bands anymore because we have found that bands are not as effective as the other surgeries, and people have had some issues with the lap band. Most of our revision surgery is taking out somebody's lap band and doing a gastric sleeve or a gastric bypass instead. Dr. Balsama did do the lap band years ago, but experience really has taught us that that is not the route to go, that the sleeve and the bypass are really superior surgeries. Sleeve and bypass actually address the chemistry of obesity, where the lap band doesn't, Weight Watchers doesn't, or any diet you have tried really does not either. He does all the surgeries laparoscopically. That means he does them through tiny little holes in your belly. They're very, very tiny little holes. He doesn't even sew them up afterwards. He puts a little skin glue on there to close up those little incisions. Because he does it laparoscopically, you're in the hospital only one night, and you are back home the very next day. You're back on a regular diet in about 5 weeks. You're up the very same day, walking, by the way. Most people get back to work in 2.5 weeks. So recovery is pretty quick, and it's because we're not causing a lot of trauma to your abdominal wall. So the sleeve gastrectomy, you might be able to see my pictures up on the wall here. Let's see. That one right there is a sleeve. A regular stomach, something like this. So with a sleeve, we're cutting like this. We're removing the bottom part of the stomach. So you're left with like a Chiquita banana shaped stomach. It's called a sleeve because the doctor who named the surgery thought that the stomach you have left looks like a shirt sleeve. Really, it looks like a banana. So you have this little banana shaped stomach. You're eating much less food because you have a smaller stomach. But then when we remove that bottom part of the stomach, we're removing chemistry that plays a role in your appetite, your metabolism. People just don't feel hungry after surgery. So you're losing weight by a couple of reasons. We expect about a 65% weight loss of your excess weight, and we're really happy with that. Most people can have the sleeve. About 90% of people do have a sleeve. There's a certain number of people who should not, and that's somebody with severe acid reflux. Sometimes the sleeve can make it worse, so we will often recommend a gastric bypass. Now, in order for us to know, let's say you do have acid reflux and now you're concerned about it, is we do that upper GI to evaluate that condition to give you the best recommendation. There's another condition called Barrett's esophagus that's caused by severe acid reflux. We would then recommend the gastric bypass for you instead. So we're really happy with the sleeve, and so are many of the people who have the sleeve. Now, some of the benefits are that we're not cutting intestines or rerouting. It's very easy to do. Complication rate is low. You get pretty good weight loss with the sleeve. You don't have much of an appetite, so it gets an A+ in our book. It's really good for medication absorption. Does a little bit of a better job of absorbing medications than the bypass. You do have greater food tolerances. That might be a good or a bad thing because it means you can get away sometimes with eating things you shouldn't. If you have arthritis, rheumatoid arthritis, autoimmune disease, you'll probably do better with the sleeve because the sleeve just does a better job with medications. It is a little bit of a slower weight loss. And then again, if you have Barrett's esophagus or bad acid reflux, you may want to consider the gastric bypass. So if you look at the pictures up here again, that one right there is the gastric bypass. So with the gastric bypass, we don't remove any part of your stomach. We just separate the top part of your stomach from the bottom part of your stomach. So in a sleeve, we take your whole stomach and turn it into a banana. With a bypass, we take your whole stomach and turn it into a plum. But the bottom part of your stomach, you get to keep. That bottom part of your stomach will never see food again, but it still works really hard. And because of the mechanism by which the bypass works, you have to keep that bottom part of your stomach. We do have to involve intestines because when we create that little stomach pouch, it doesn't have a piece of intestine attached to it. So there is a little bit of intestines that we have rearranged in such a phenomenal way that it really makes the bypass an ideal surgery too, especially if you want to maximize weight loss. You do get about a 15 to 20% additional weight loss with the gastric bypass. So with bypass, we restrict how much you eat, so you lose weight. You also have that appetite suppression and hormonal changes, just like in the sleeve, so you lose weight. Something else the bypass does is malabsorb. Malabsorb means not everything you eat gets absorbed. That does include some medications too, by the way. So if it's calories, if you eat 100 calories of food with a sleeve, you absorb 100. If you eat 100 calories of food with a bypass, we don't know the exact number, but maybe 70 you don't absorb. So all along the way, you're never getting the same number of calories as you would with the sleeve. So we believe this additional benefit provides about a 15 to 20% more weight loss with the gastric bypass. Bypass also offers some feedback. So you're going to be sensitive to carbs and sugars, which is a good thing because you really need to be really low carb sugar after bariatric surgery. Sleeve does let you get away with it a little more, though if you overdo it, you're going to probably throw up. With the bypass, if you overdo it with the carbs and the sugars, you're going to have something called dumping, which is diarrhea for sure, like almost immediate diarrhea, but then you feel really sick that you have to lay down. Now that's not a good thing, but it can be a good thing if it modifies your behavior. Let's say you're a carbaholic. Well, this isn't going to let you be a carbaholic. So therefore, you're going to do a little bit better in your weight loss because of that benefit. Bypass is the longest track record. Some people are still afraid of the bypass, but there's nothing to be afraid about. Sleeve might take a little less than an hour to do. Bypass might take an hour and 15 minutes if to do. 1 day in a hospital for each. The same diet guidelines for each, the same vitamin recommendations for each, the same return back to work for each, the same recovery for each. So the only difference is one is recommended for some people and the other is recommended for other people, depending on the condition of your GI tract. Sometimes people will ask me which would I prefer. Well, based on my health history, I would have to get one versus the other, but it would be based on my health history, not that one is better than the other, because that's just not the case. So the bypass, if you have had diabetes many years on insulin, the bypass might do a better job of controlling that. Sleeve does a good job, but the bypass may do a little bit of a better job. Maximum weight loss, of course you choose the bypass. Bad acid reflux or Barrett's esophagus, of course you would choose the bypass. Carb addiction might control that a little better with the bypass. Arthritis, you want the sleeve. If you have too much scar tissue in there from other surgeries, the sleeve might be a better option as well. If you have chronic anemia, sometimes the bypass will make that work, and so therefore we will want you to have the sleeve instead. So as you can see, there are reasons to have a bypass, there are reasons to have the sleeve. So the doctor does need to get a good health history on you so we can evaluate which one really would be the best surgery for you. Revision surgery is if you've had surgery already and for whatever reason it didn't work, you're having trouble with it, then we revise it into a different surgery. Our number one revision surgery is removing lap bands and giving that person a sleeve gastrectomy or a gastric bypass instead. Sometimes a person has a sleeve and we turn it into a bypass. Then sometimes people with a bypass have issues, and then we do refer out for that, and we would refer if you're looking at this because you're interested in the gastric bypass. These bariatric surgeries are very safe. They're about as safe as you're getting your gallbladder out. So they're not big, scary animals as they used to be years and years ago. You're in and out most of the times without any issues. Now, there are complications of life, just as there are complications of any surgery. Complications are rare, however. The number one thing we do see is dehydration, because it's really hard for people to drink enough fluid because their bellies are sore right after surgery. So that's what we see. But the list of them could be infection, pneumonia, clots, some bleeding, death, which we really don't see. We do all we can to prevent all these complications, so that's why they are so rare. One thing that remotely we see is something called a leak. A leak is wherever the doctor cut and he put a staple, maybe one of those staple spots didn't close completely, so stuff from your stomach can leak into your abdominal cavity, creating an infection. That prolongs your recovery, and that's about it. But we don't see that happen very often. So just know that there are risks to everything that you do in life, and surgery is really no exception. But our statistics on complications are really, really good. One night in the hospital, you get clear liquids in the hospital, and when you go home for the first few days, your diet is progressed up over the next couple of weeks until you're able to eat food again. You can shower when you go home. We want you up moving around. Most people really do. Some people get back to work the following week after surgery, but most people get back to work in about 2.5 weeks. You're going to have my phone number, my email address. You can text me, you can call me, you can email me, you can get hold of me, however you need to make this feel really good for you, especially once you're home from the hospital. So as a comparison, sometimes it's just your personal preference based on experience from other people. And if the doctor says it does not matter what surgery you have, then the choice is really yours. If he believes he has to make a recommendation based on prior surgeries you've had, or based on some health issues that dictate one surgery will be better for you than the other, then he is definitely going to give you that recommendation. And he will not leave you astray. So how do you decide? Well, we just said that one size doesn't fit all. Risks and the benefits, though, are pretty similar. Overall weight loss, you do get a little bit more initially with the gastric bypass. Follow-up is the same. Recovery is the same. Your overall health sometimes dictates what surgery is going to be better for you. So a lot of things go into making the decision about what surgery is best. There are other benefits besides getting healthier, which is really the best benefit you can experience from weight loss surgery. But just not having to worry about fitting in a booth at a restaurant, or if, God forbid, you should ever fly, that can be extremely uncomfortable. Just crossing your legs, that skinny people tend to take for granted. Getting on and off the floor, just keeping up with everybody else. Are other, I would say, fringe benefits of bariatric surgery. Buying clothes wherever you want to buy clothes are definitely fringe benefits of bariatric surgery. So I hope you enjoyed this quick chat. Expect to get some things in the email. Then call our office, say you had a seminar with Chris, so you can get your appointment scheduled with Dr. Balsama. We have 2 offices, one in Stratford, one in Seoul, and whichever is more convenient for you, that's where you can make your appointment. And any questions after this, I'll be emailing you, so feel free to email me back with any questions that you have. And with that, I thank you for your attention, and I really hope to see you in the office soon. All right, you take care. Bye-bye.